CNA scope of practice. Welcome to the quiz. Question 1. You're assisting Mr. Henry Thompson, a 70-year-old patient, with passive range of motion exercises for his upper extremities. The patient has limited mobility due to recent surgery and is unable to perform active exercises independently. You are gently moving his arms and shoulders through their normal range of motion. As you move his right shoulder, he begins to wince and reports pain, and as you continue to move the joint, his facial expression indicates increasing discomfort. You need to determine the appropriate endpoint for range of motion exercises. Based on proper technique for range of motion exercises and the importance of preventing further injury, when performing range of motion exercises on a patient, you should move the joint until Option A. The patient experiences sharp pain or significant discomfort, at which point you continue moving slightly further to help stretch the muscles and increase range. Option B. The patient feels gentle resistance or mild discomfort without sharp pain, at which point you should stop and move the joint in the opposite direction. Option C. The patient's muscle begins to quiver visibly, indicating that the muscle is being adequately stretched. Option D. You have completed exactly 100 repetitions of the movement regardless of how the patient is feeling. The answer is B. ROM exercises should be performed to the point of gentle resistance, not pain. Option B is correct. Option A is wrong. Sharp pain indicates injury. Never force beyond that. Option C is wrong. Muscle quivering may indicate fatigue or injury. Option D is wrong. Repetition should be appropriate, not arbitrary. Patient response guides the exercise. Question 2. You're attending a mandatory safety training session in which your facility is reviewing emergency procedures. The instructor is teaching staff about what to do in case of a fire in the hospital. The facility uses the RACE acronym to guide staff actions during a fire emergency. The instructor is asking staff members to identify what each letter in the RACE acronym stands for. Based on standard fire safety procedures in healthcare facilities, what does the acronym RACE stand for in the context of fire emergency response? Option A. RACE stands for Recover, Assess, Check, Evacuate. Option B. RACE stands for Rescue Patients from Immediate Danger, Sound the Alarm to Alert Staff, Confine the fire by closing doors and windows, and evacuate patients and staff as directed. Option C. RACE stands for Response, Alert, Care, Emergency. Option D. RACE stands for Rapid, Assist, Clarify, Exit. The answer is B. RACE is a standard fire response mnemonic: rescue, alarm, confine, evacuate. Option B is correct. The other options are incorrect acronyms. Question 3. You're attending an in-service training session on body mechanics and safe patient handling. The instructor is demonstrating proper lifting and movement techniques to prevent back injuries and strain injuries among nursing staff. She is asking staff to identify the essential principles of proper body mechanics when lifting patients or moving heavy objects. Based on principles of proper body mechanics and ergonomics, which statement best describes proper body mechanics when lifting a patient? Option A. You should bend at the waist and use primarily your back muscles to lift, as this distributes the weight across your entire back. Option B. You should keep your feet close together, twist your torso to rotate your body, and lift with your arms extended away from your body. Option C. You should keep your back straight, bend at the knees, keep the load close to your body to reduce strain on your back, and use your leg muscles to generate the lifting force. Option D. You should lift with your arms while standing on one leg and trying to balance, as this strengthens your core muscles. The answer is C. Proper body mechanics involve using leg muscles, keeping back straight, and load close to body. Option C is correct. Options A, B, and D describe unsafe techniques that increase risk of injury. Question 4. You're making rounds with your supervising nurse when you realize that you made an error in patient care. Earlier in your shift, you accidentally spilled a full glass of water on a patient's bed while assisting them with hygiene, and instead of reporting it immediately, you changed the wet linens and did not tell anyone about the incident. You are now feeling anxious and guilty about the error. Your nurse is explaining to staff the proper procedure for handling mistakes. When you make a mistake or error in patient care, what should you do? Option A. Keep the error to yourself and try to fix it without telling anyone, hoping that no one will ever discover that an error occurred. Option B. Tell another nursing assistant about the mistake, but ask them not to report it to the supervisor or nurse. Option C. Immediately report the error to the nurse, explain what happened, and work together to determine if the patient was harmed and what follow-up care might be needed. Option D. Only report the error if you believe it caused the patient actual harm or injury. Otherwise, you can document it in the chart without telling anyone. The answer is C. All errors, even those without apparent harm, must be reported immediately. Option C is correct. Option A is unethical and can lead to patient harm. Option B is gossiping and does not resolve the issue. Option D is wrong. Errors should be reported regardless of perceived harm. Question 5. You are reviewing infection control precautions in your facility's training materials and learning about different types of transmission-based precautions used for different infectious diseases. You are studying the different categories of precautions, including standard precautions, contact precautions, droplet precautions, and airborne precautions. You are trying to understand which types of patients require contact precautions specifically. Which type of patient would require you to use contact precautions in addition to standard precautions? Option A. A patient with pneumonia who has respiratory symptoms and is coughing frequently. Option B. A patient with a draining infected wound, diarrhea from Clostridioides difficile infection, or other conditions where infectious agents are present in body fluids or wound drainage. Option C. A patient with flu symptoms who is sneezing and coughing but has no open wounds. Option D. A patient with a fever of unknown origin who has not yet been diagnosed with a specific infection. The answer is B. Contact precautions are used for patients with infections spread by direct contact, such as infected wounds, C. diff, MRSA in wounds, etc. Option B is correct. Option A and C describe droplet precautions. Option D is not specific. Question 6. You are reviewing the procedures for hand hygiene throughout the patient care day and understanding when hand hygiene should be performed. Your facility emphasizes the importance of frequent hand hygiene in preventing healthcare-associated infections. Based on current infection control guidelines and best practices for preventing transmission of infectious agents, when should hand hygiene be performed during patient care? Option A. Hand hygiene should only be performed at the very beginning of your shift when you first arrive at work. Option B. You should only wash your hands when eating meals and after using the restroom. This is sufficient for patient care. Option C. Hand hygiene should be performed before and after each patient contact, after contact with body fluids or contaminated materials, and whenever your hands are visibly soiled. Option D. Hand hygiene is only necessary once per day. If you wash your hands at the beginning of your shift, you do not need to wash them again. The answer is C. Hand hygiene must be performed frequently, before/after each patient, after contact with contaminants, and when visibly soiled. Option C is correct. Options A, B, and D are incorrect and unsafe. Great job! Don't forget to subscribe. Bye!